Welcome to Using SOAR to Connect Veterans to Social Security Benefits, a webinar sponsored by the National Veterans Technical Assistance Center, or NVTAC. My name is Cindy Borden, and I'm the Assistant Director of Training and Technical Assistance at the National Coalition for Homeless Veterans, NCHV, and we are one half of the partnership that makes up the NVTAC, the other being Advocates for Human Potential. We're really excited for our webinar today. We have Jen Elder from Policy Research Associates, Inc., who's going to be our guest speaker today to talk about SOAR. Before I turn things over to Jen, I do want to just go through a couple of housekeeping things about our webinar. You may have noticed that you are muted and you cannot talk through the phone lines, and you cannot hear what we're doing. I'm sorry, not that we can't hear what you're saying. Sorry, you can hear what we're saying. And that is by design for our webinar today. All of the phone lines are muted, but you can ask questions throughout the webinar by using the chat function on the webinar portal to your right-hand side of your screen. You'll be able to ask those questions throughout. I'll be collecting, and we will save time at the end of the webinar to answer any questions that folks have had. If there's something that's urgent in between, I'll ask Jen to pause for a second and I'll share those questions as well. We will be recording the entire webinar so that if you are not able to stay for the entire webinar, or if you hear something and you decide later that you really want to hear that piece again, you'll be able to come back and listen to the webinar, and it will be posted on our website. There will also be a survey that will pop up as soon as the webinar is over. We'd love for you to fill it out right then while it's still fresh in your mind. We really do take your feedback into consideration as we're planning future webinars, future content, and also if there's other questions that you have that you think of, you can put them in the comments box of the survey. If you aren't able to stay for the whole webinar, you will be getting a follow-up email from us tomorrow, and the survey will be in a link there as well. So please it's about 5 questions, so it should only take a couple of minutes, but we really do appreciate that feedback. So with that, before I turn things over to Jen, I did want to give a little bit of an introduction. So Jen Elder is the National Policy and Partnerships Coordinator for the SSI SSDI Outreach, Access, and Recovery, also known as SOAR, Technical Assistance Center at Policy Research Associates, Incorporated. She develops policy guidance and tools for training providers on increasing access to Social Security disability benefits. And she works with federal partners to incorporate income stability into national policies to end homelessness. Ms. Elder specializes in serving veterans with disabling conditions and works closely with the VA's Homeless Programs Office and us here at NCHV to provide technical assistance. Her previous experience includes coordinating street outreach and shelter services for chronically homeless individuals in both Nashville, Tennessee, and also London in the United Kingdom. She also used to develop organizational policy and training guidelines for emergency shelter staff. So as you can see, she's got a lot of great experience to share with us. She is a military spouse, and she's based at Fort Bragg, so she comes at this from a couple of different angles. So with that, Jen, I'm going to hand things over to you.
Great. Thank you so much, Cindy. And thank you for inviting me to join you all today. This is really exciting that you're taking time out of your busy schedules to learn about Social Security benefits. I know sometimes it can be a big, convoluted, confusing area. So I appreciate you guys taking the time to talk with me today, and we'll definitely be sure to leave time at the end for questions. I'm excited to partner with HVRP grantees to help supplement the great work you're already doing in helping veterans increase income through work. And where I think SOAR and Social Security benefits can really help supplement your work is by getting additional income sources for those veterans who may not be able to completely sustain themselves through employment due to disabling conditions. And so, we know that income support and stability is so crucial for stable housing that we may need a combination of employment and benefits in order to achieve that goal. So today we'll cover a few things. Basic, what is SOAR? So if you're there and you're kind of wondering what it is SOAR stands for, what we do. We'll cover that, as well as our great SOAR outcomes, sort of a why should you be listening and interested in this model. We'll go over the very basics of the definition of disability for Social Security to help you identify those individuals you may work with that could qualify for these benefits, where it might be good to refer them to a SOAR worker. And then we'll cover some employment and Social Security benefits myths and truths, because we know there's so many misconceptions floating out there. So we'll hit those highlights, and then a call to action. If you've liked what you've heard today and want to get involved, I'll be sure to let you know how you can join the SOAR community and help veterans with Social Security. Next slide. So as Cindy said, SOAR stands for SSI SSDI Outreach, Access, and Recovery. SSI and SSDI are the two disability programs through Social Security, and we use an outreach model to help people who are experiencing or at risk for homelessness and who also have disabling conditions access these Social Security disability benefits. So SOAR is a model for helping people apply for Social Security. It's not a completely separate thing with Social Security, not a different program. It's a model that we train caseworkers how to provide that assistance. As I mentioned, Social Security can be complicated and intense with lots of paperwork, and so it can be confusing for us as providers, and so it certainly is confusing and can be out of reach for individuals experiencing homelessness and severe mental illness. We are sponsored by the Substance Abuse and Mental Health Services Administration, or SAMHSA, and we've worked in collaboration with the Social Security Administration since 2005. We're active in all 50 states, so wherever you are, we can help you get in touch with someone who is either actively working on SOAR or working on building this initiative. Though we don't have direct funding from SAMHSA to do this work, it's really impressive what people around the country are doing. I did want to mention, since I forgot about the at-risk for homelessness, I just want to highlight that for SOAR and our definition, we would include those who are in permanent supportive housing or who have accessed housing through the Housing First model. So if you're in those housings and you're being supported by grant funding and don't have your own income to support yourself in housing, to us that's still at risk for homelessness. So there's a lot of different groups of people that we can serve with this model. We're really proud of our outcomes. We just published these. These are current through June 30th of 2015. And since 2005, over 27,000 individuals experiencing or at risk for homelessness have been approved on the initial application. Our national approval rate is 65% overall, in an average of just 81 days. So in less than 3 months, these individuals are able to access income and health insurance and stable housing. Now this compares to 10 to 15% approval rate for people experiencing homelessness who don't have assistance, and just 28% for all applicants. So using our model, we're able to boost that all the way up to 65% nationwide. Appeals, as I'm sure many of you know, can take a year or 3 years, and many people are giving up and they don't appeal, and they are living on our streets or in our shelters and are absolutely eligible for these benefits, but need a lot of help in order to access those. We also support our communities. This is bringing federal money to individuals who are turning around and spending that in your local economies. So just in 2015 alone, we estimate that individuals served through SOAR brought in nearly $275 million into the economies of states and localities. This is a really important point that we like to include because it's a great selling point for this. As I mentioned, we don't have direct funding for this model, But there's ways to leverage the great work we do to incorporate this into your community and into your organization. Next slide. So while I said we are very proud of our 65% approval rate, we like to highlight our top 10 SOAR states. They've served almost 9,000 applicants between them, and they have an 84% approval rate on initial applications. And in some of these states, the days to approval is as low as 37 days. So it's really incredible what people around the country are doing using this model. And the approval rates are highest in places where more critical components are used. We're not going to go over all of those components of SOAR. We have a comprehensive online training program that will cover it, which I'll mention near the end. But basically, it's proactive assistance in gathering medical records, helping individuals fill out the forms, and writing up your observations as workers on how an individual's disabling conditions are impairing their ability to sustain themselves fully through employment. Next slide. Now, just to go over the very basics of Social Security, because I'm going to be spitting lots of acronyms throughout this presentation, but these are the big three. SSA is Social Security Administration. SSI is Supplemental Security Income. This is the needs-based program. I'm sure many of you come in contact with individuals who are on SSI, or those who know that they receive the standard $733 per month. This is for individuals with disabling conditions who have low income and resources, and it provides Medicaid in most states. SSDI, or Social Security Disability Insurance, is the program that you pay into when you go to work. And because you're putting earnings into that system, the amount that you receive back depends on how long you've worked and how much you've paid into that. And this program, it doesn't count the resources and the income. It is based on how much you've worked in the system, and it comes with Medicare, generally after 2 years of eligibility. But the key to note is the disability determination process for both programs is the same. So when we talk about them together. So really, the easiest way to think about this is just thinking Social Security disability benefits. No need to get all into the weeds with each program. The next slide. Now, why is this important for veterans specifically? So veterans can receive Social Security in conjunction with or as an alternative to VA disability benefits and employment. I find sometimes there's a lot of myths out there about how if you're employed, you can't receive the other benefits. If you get VA benefits, you can't receive Social Security. But that's not always true. And so they can receive this source of income in conjunction with the others. It's also incredibly important for the health insurance that comes with Social Security. So they can utilize Medicaid and Medicare health benefits to supplement VA health services. And this is particularly important for those veterans who don't have access to VA health services. So this insurance can come in and pay for those critical health supports that they need. So when we think of income stability, it's about getting the right combination of these. So everyone that you work with may not be eligible for Social Security, and that's fine, and may be able to support themselves through employment. Or they may need to have a combination of Social Security and VA benefits, or employment and Social Security. There's no one right answer for every veteran. I just want to kind of promote this program with you all so that you know that this is an important option that could be available for the veterans that you serve. Next slide. So for those of you who may be more familiar with VA disability benefits because of your work with veterans, I just wanted to point out a few key differences with Social Security. So discharge status is not a factor with Social Security. The disabling condition doesn't need to be related to military service. And so as a result, people may be denied for VA benefits, but still be eligible for Social Security. However, a lot of times they don't know that. They think, oh no, I've been denied, I'm just not eligible for benefits. So that's not the case. And also, they don't need to have received a decision on their VA case before the Social Security case can be decided. They're decided by two separate agencies, two separate definitions of disability, and one decision doesn't necessarily impact the other. And then lastly, there's no partial disability with Social Security. So while VA has their rating system, 10% to 100%, with Social Security you either fully meet the definition or you don't. There's no in between. Next slide. So in the kind of biggest nutshell of what they looking for with Social Security, the vet needs to show that because of a physical or mental condition or a combination of the two, that those conditions are limiting their ability to work at what they call a substantial gainful level. Now, Social Security every year puts a dollar amount to this, and in 2016, it's $1,130 a month. So an individual can work, but maybe they can't work to fully sustain themselves. They're not able to earn over that amount because of these disabling conditions. And they're looking for how does it impact them? Does it impact their ability to take care of their daily needs, to interact with others, to concentrate or remember things? How is this affecting the individual's ability to work? Now, the second key with this is Social Security is not a short-term disability program, so the disabling condition must have lasted or expected to last for 12 months or end in death. So the biggest question they're looking for is, why is the applicant unable to work and earn $1,130 a month? Next slide. So there's a couple fast-track programs that Social Security has that can expedite the decision process for anybody who fits these two criteria. So the first one is the 100% Permanent and Total Veterans Initiative. This is a newer initiative just out for the past 2 years or so, and it's for those veterans who have 100% permanent and total rating from the VA. Now, I just mentioned you don't have to have a decision already from the VA, but some veterans may have already received that and just not know that they could also be eligible for Social Security. So individuals in the military, when they're working, they're also paying into the Social Security disability insurance system. So they could be eligible for this additional funds. So if they have 100% P&T, they just let Social Security know that when they're applying. It doesn't guarantee approval, even though they have that, strong rating from the VA. They still have to meet the Social Security definition of disability. But while not guaranteeing approval, it does guarantee a very quick processing. The second program, many people have heard about. It's been around for a long time, and that's for veterans who received a disabling mental or physical health injury while on active duty on or after October 1st, 2001. The key thing I like to mention with this program is that the injury does not need to have occurred during combat operations. So it doesn't need to be, in theater in Iraq or Afghanistan. It could be at home in a car accident or some traumatic event that happened while the individual was at home. It's just that they were on active duty. So both of these fast-track programs, it's important to let Social Security know because, with SOAR, we're so proud that we get the decisions in months, not years. With these fast-track programs, it could be weeks, not months, and that's so important for the individual to be served. So that's the very basic overview of definitions of disability before we go into a little bit on work. And I only say that because what I want you to take from this is just starting to identify who you're working with that could be eligible for these benefits. So you can start those conversations with them. As I said, at the end, I'll give the information about our training program if you want to dive a lot deeper into the ins and outs of Social Security. But I just wanted to get you thinking of individuals that may qualify for these benefits. So now we'll talk a little bit about work, since that's a lot of what you do, providing employment support. So I want everybody on the call to become a mythbuster for us, because we know how pervasive these myths about Social Security and working are. And as a result, individuals are missing out on key income that they could have because of this. And we know that individuals experiencing homelessness just can't. They need all the income they can to support themselves. And I always get so upset when we hear people being told, no, you can't work while you're applying for disability, because at the end of the day, they still have to eat and they still need money. And so that's a very, very dangerous myth, I think. So if you work, your application is going to be automatically denied. Absolutely not true. And we'll go into a few more details about that in a minute. A couple other myths are your benefits and your health insurance immediately end when you start working. So you go to work one day and then you have absolutely no safety net. That's also not true. There's a big myth, too, that you can only work part-time or 20 hours per week while receiving disability. So Social Security will look at how much money you're making while receiving disability, but it's based on that. It's not based on a number of hours or part-time versus full-time. It's based on a lot of other factors. And finally, if Social Security knows you're working, they'll say you aren't disabled anymore. And that's really scary, because we know how hard individuals fight to get these benefits that they are eligible for. And so it's really scary that, you know, as soon as they try work, they're just going to lose them. And so we want to make sure that we're having these conversations so we can help eliminate these fears. So again, lucky for us and for our veterans, all of these myths are completely false. So next we will start talking about working while applying for Social Security. Biggest takeaway, you can work during the application process. I know you probably have heard for years, and you will continue to hear for years, people saying that you can't, but you can. So you'll all be mythbusters about that. Social Security is looking at the type and the amount of work that you're doing. As I mentioned before, you can earn up to $1,130 a month. So they're looking to see, are you unable to earn over that due to your disabling conditions, due to symptoms, or are you not able to earn more than that because you know that's the limit and you won't take the extra hours to try to make yourself eligible? Those are two very different scenarios. So for instance, I worked with a young lady once, and she could earn maybe $600 to $800 a month as a waitress. And say like, oh, that sounds like she can, you know, start to support herself. But when I started to dig deeper into it, you know, the more she tried to work, if she picked up extra shifts, her anxiety and her panic attacks would get so bad that then she would have to take the next week off of work. Or her employer would allow her to take a lot of extra breaks during the day. Or, you know, one big thing was that if she got panicked during work, she was allowed to go back into the freezer area and, you know, take time for herself and, as she would say, scream it out. That's information that's not easy to see when you're looking at the dollar amount, you know, and that's all makes a great case for Social Security. So they want to know these nuances. It's not just, are you working or not? They can see that, you know, the employer is giving a lot of accommodations for her to be able to work, and she really, you know, as much as she's tried, cannot work and earn over that amount due to the symptoms of her illness. And so that was a great success story that I had of someone working while applying. So we want to encourage work from the start. It can help strengthen the application. As supportive employment case managers and providers, you can help document somebody's struggle work. So maybe you're working with someone who's trying to work but not able to work all the hours, or has to call in sick a lot, or struggles with certain tasks. All of those things can strengthen an application. And also, on the other hand, you might find that supported employment works better for the individual. So that's why we always, with SOAR, want to encourage work from the start, because if someone can find substantial employment and be able to function, ultimately they're going to earn more than they would be able to earn from SSI, and so that is best for the individual to do that. So always a good thing to encourage work from the start. Next slide. So after an approval for Social Security, you also can work while receiving both SSI and SSDI. So we want to connect individuals with work support programs. So the wonderful ones with HDRP, and also Social Security's Ticket to Work program. They have a wonderful website, chooseworkttw.net, and they also have access to job coaches, supportive programs, and other different work incentives, which is the next strategy that help not only encourage but support someone going back to work. And so they have certain incentives that allow an individual to keep a little bit more of their money, or maybe save for an educational goal. All of these resources can be so beneficial. And so it seems like Social Security, doesn't want people to work, but they actually have so many programs to support this. So we want to utilize all those work incentives, which are too many to go on into today. But we have a ton of resources. I added our website here. We have a spot in the library just on employment and work, where we have tools and other resources to walk you through all of the available support for individuals. Next slide. So while I said we weren't going to go into all of them, we are going to go into one, because it is my favorite, if one can have a favorite Social Security work incentive. But it's one that people typically don't know about, and I think it's one of the best things that Social Security does. It's called Expedited Reinstatement of Benefits. It applies to both SSI and SSDI. And so with this benefit, for 5 years after the benefit ceased due to earnings, so say someone goes to work and they're doing really well, and they're doing so well that they're not, they don't have their SSI or SSDI check anymore, but something happens and the symptoms come back and they're suddenly unable to work, and that's scary. It's like, oh, do I have to go through this whole process again? But they don't, because they can utilize this wonderful tool. So for up to 5 years after this happens, they can request an expedited, when I say 5 years after, 5 years after the benefit ceased due to earnings. So it's a 5-year window they can work, and if something happens, they can access this tool. And it's an expedited return to payments and to medical benefits. So it's not the same thing as a full new application. There is a medical review that's done, but it's less intensive than the initial review, because all they're looking for is to see if the current condition is the same as or related to the original condition. So say somebody was originally approved for a diagnosis of major depression, but they're suddenly unable to work because of a back injury. So that wouldn't qualify for this program because the two conditions aren't related. But if it's because of the symptoms of major depression again, maybe they've had to go to the hospital and just unable to work and earn substantial gainful activity, then they could qualify for this program. So while the review is being done, applicants can immediately start to receive 6 months of provisional benefits while the decision is processed. So that is, all they do is they go and they, as long as it's in good faith, they think they qualify for this, they're immediately put back into payment, and they aren't responsible for repaying that amount in case the claim is denied. So as long as in good faith they said, I think I qualify for this, they don't have to return those months of benefits. So I think it's amazing. That's why I like to talk about it. All they need to do is go to the local Social Security office and ask for the expedited reinstatement of benefits. It's an amazing safety net for individuals who are wanting to return to work. Next slide. All right, so SOAR and HVRT strategies. What can we do and take away from this? The biggest thing that I would love everybody to do is just to educate veterans and anyone else you work with that you can work and receive Social Security disability benefits. So be that mythbuster. Don't let these awful rumors continue. Don't let people miss out on this much needed income because of these silly myths that are persisting out there. Utilize Social Security's work incentives and the Ticket to Work program. It's so amazing. I know you'll have to take my word for it because we couldn't go into all of this today. But there's a lot of great things too. I'll throw in another that if someone is following a work plan with using their Ticket to Work and working towards employment goals, they are exempted from continuing disability reviews, which can be really scary for people. So that's when Social Security will take another look at your case a couple years down the line to see if you still meet the definition of disability. And that's scary because, you know, oh, maybe I shouldn't go back to work because they're going to look, they're going to see I'm working, and then they're going to take all my benefits away. But so individuals who are using this Ticket to Work and working towards vocational goals are exempted from these reviews while they're making progress. So that's huge. That takes a lot of weight off people and a lot of worry. So, and lastly, celebrate successful examples of veterans who work while receiving Social Security benefits. So hopefully there's some locally that you can, you know, find and get people to share their story. Because I think while it's all well and good, while us, you know, experts talk a lot about Social Security policy, I think it's much more powerful for people to hear it from peers and to hear it from others who have been through the process. So we try to encourage people telling their stories through our National SOAR TA Center, but finding someone locally who can say, yes, this is possible, it doesn't have to be as scary as we think it is, can be so powerful. So through these strategies, our whole goal, you know, working with NCHB and your group is we want individuals to access all of the income that they are eligible for to increase that housing stability and end homelessness. Next slide. So if so far you've liked what I've heard and you're interested more in about SOAR and Social Security, there's a couple of resources. These are all available on our website, which is listed on the screen. There's a full issue brief. It's about 8 pages on connecting veterans to Social Security disability benefits. This goes through all of the different nuances that I had talked about where, the fast track programs and how Social Security and VA benefits impact one another. And it also talks about some frequent conditions we see in veterans who are experiencing homelessness, such as high rates of traumatic brain injury, PTSD, military sexual trauma, and how those conditions can meet the eligibility criteria for disability. So that can be a good resource. We also just created a tip sheet on SOAR and HVRP that's available on our website as well. much of this presentation was based on that tip sheet, so it kind of condenses everything down just into a front and back page, which might be a little easier to digest. And then reach out to us at the SOAR TA Center. My contact information will be on the next screen, and reach out anytime with questions and to help you plan how to use SOAR. I can help connect you with local SOAR leads in your area. There's, as I mentioned, some SOAR training available that is free, completely free. It's all online at our website. So it's a comprehensive training that we estimate takes about 16 to 20 hours to complete. Now, I know that sounds scary at first, but it walks you through exactly how to file an application for Social Security, which, as I mentioned, lots of questions, lots of forms, can be confusing. And so we help by creating a sample applicant. And so all trainees through our course will complete a full Social Security application based on that sample applicant. And then they turn that application packet into us at the SOAR TA Center, and we have experts individually review all of the forms and what we call a functional narrative written about how the individual's disabling conditions impair their ability to work. And we have a SOAR expert review all of those materials and provide individualized feedback so that you are set up for success at the end of that training. And because I know it's a lot of work, that does come with 16 free CEUs upon successful completion. So for those who some CEUs for your license, that is a great option. And also collaborating with community partners to refer veterans to local SOAR initiatives. If you are unable to take the SOAR training and help with these applications yourself, reach out and find someone else in your community. Hopefully there's a local resource who can help the veterans that you're working with. On our website, you'll see a button that says SOAR in your state. If you click on that, you can click on your state and find the contact information for your SOAR state lead. That's someone who is located in the state and helps run all the local SOAR initiatives. There's also a national SOAR TA Center liaison for every state who's very knowledgeable in all of the local initiatives. And then there's a list of contacts for local leads and trainers. And so there might be a local lead in your city that you can reach out to and connect with to help out your veterans. So next screen, I believe, is just my contact information. We can leave that up. Again, our website, we post a lot of resources on our Facebook and on our Twitter as well, so we encourage you to reach out and connect with us. And that is what I've got. Time for questions?
Thank you, Jen. Please continue to ask questions. Jen, we did have a couple questions, again, just asking for clarification about somebody's ability to work while they are receiving Social Security benefits.
So kind of in general how that affects the benefits?
Yes, that's right.
Okay. Yeah, so kind of the most basic way to explain, it'll affect it differently based on if the person is receiving SSI or SSDI. So with SSI, they reduce the amount of the check. Remember, that's the needs-based program. So if you're getting more money, Social Security says you need less, they'll reduce that SSI check $1 for every $2 that a person earns. And again, some of these work incentives can help reduce that amount taken out of the check. Now, that sounds scary. You go back to work and your check is suddenly reduced, but we have calculations available in our tip sheets and online that help show that what we say is work pays. The individual will always come out ahead because they can earn up to, I think it's just over $1,500 a month before that SSI check gets to zero. So that, yes, their SSI check is being reduced, but ultimately they are coming out way ahead by working. So SSDI, though, it is a little bit different. They have some programs called the trial work period where you can go back to work for 9 months in any 5-year rolling period and earn as much as you're able to and still qualify for your full SSDI check. Then after that time, they move you into a different phase where if you earn over that $11.30 a month or whatever it is for that year, then you won't be qualified for your check that month. But any month where your earnings fall below that amount, you can get your full SSDI check. So it's a lot of safety nets that I guess hopefully I'm not getting too technical, but the kind of nutshell with SSDI is there's a ton of safety nets. If someone is unable to work, they can just let Social Security know, and then they'll get that full SSDI check. And again, with SSI, it fluctuates every month based on earnings. So if there's 1 month where someone's really struggling to work, then their SSI check isn't reduced as much, and so they'll still have that safety net of income.
Great, thank you, Jen. We have another question which may be beyond your expertise, but I thought I'd ask it anyway in case you had some suggestions. And this question is around advice or strategies for a homeless veteran who is receiving Social Security disability benefits, but is getting money taken out for child support in arrears for adult children, money that was previously owed, which is making that check so small that the veteran is not able to use it to cover basic needs. Any suggestions or strategies for what a provider can do to help that veteran?
Yeah, in that case, again, I'm guessing that's an SSDI check, but I would talk with Social Security because what they can do in a lot of these cases is work out a different terms of payment for the payment plan. I'd have to look into child support specifically, but I know in other cases for overpayments that are collected out of both SSI and SSDI checks, there is negotiating room with Social Security. There's some information on our website about overpayments that will have some of these forms, and it's just filling out a form showing, you know, what hardship that is causing by taking that money. And so is there a way to make the payment amount each month less? And it's usually a pretty good case to give to Social Security because ultimately they, you know, want individuals to use their checks to meet their basic needs. And so that's a strategy that I would employ, is talk with them and see what forms they can fill out to kind of renegotiate that payment schedule.
Great, thanks, Jen. While you were answering that question, someone else chimed in with a similar situation, and in this particular case, 100% of the client's check is actually being taken for payments in arrears. So that's a good strategy, a good suggestion for them to reach out directly to Social Security to see about that. We also have a question about whether chronic alcoholism would qualify as a disability for either SSI or SSDI.
Mm-hmm. Yeah, that's a great question. So in itself, it would not. In terms of just using alcohol, would not. But what can help someone qualify is all of those conditions that come as a result of chronic alcoholism. So cirrhosis of the liver is a big one. That can qualify for both SSI and SSDI because if it's to the point that it is, you know, becoming disabling for the individual, because if you took away the alcohol, that's not going to fix this cirrhosis. The person's not going to suddenly get better. And that's how Social Security looks at substance use. So someone can, you know, absolutely be using substances and qualify for disability, but what they're looking for is if you take those substances away, do they still have a disabling condition? And if not, they wouldn't qualify. But if you take those substances away and someone still has, say, cirrhosis of the liver, or maybe they're using substances to help cope with, you know, hearing voices or paranoia, you know, those are instances where someone could definitely qualify.
Great, thank you. We have another question, which is it true that if you are, excuse me a second, if you are unemployed for 5 years, you can apply for SSDI or SSI?
So if you're unemployed for 5 years, you can't apply for SSI or SSDI?
That's the question.
Yeah, no, that's not true. I know where that's kind of coming from. So SSI, I'll get that one out of the way. That you don't ever have to have worked for SSI because it's not based at all on work. SSDI, you know, thinking of it as you're paying into an insurance system. So, you know, you're covered while you're insured. And they take a look back for, you know, the last 10 years and say, oh, did you work 5 of the last 10 years? But here's where it gets tricky, because if your disabling condition arose, even if it's further than 5 years ago, if it, you know, became disabling in that period where you were technically insured from paying into the system in the past, you still could qualify. So what I would say is that stuff gets really too tricky and too into the weeds, and so specific cases with that, I would talk with Social Security, and I would also, you can find out how many work credits you paid into the system and your status by establishing a My Social Security account. And that's, you know, useful for any of us as providers, useful for the individuals we work with, where they can go on and find those earning statements and see, you know, how many work credits they've put in to qualify for SSDI.
Great, thanks, Jen. We have another question from someone who has a client who's a veteran who's been denied 3 times, it says, for SSDI/SSI, so I'm not sure if they were applying for one or the other or both. And it's gone actually in front of an administrative law judge. And the case worker is wondering if this person should try, if they should try applying through with using the SOAR model to see if that outcome might be different.
Sure, sure. What I would say there is take a look at what evidence was submitted in the initial, in all of those cases. So yes, you could apply through the SOAR model. Yes, you could apply in a new initial case. But what you need is new evidence. So there are ways you can, you know, work and see that case on what evidence was considered previously. But the key thing is if there's no new evidence, there's not going to be a different outcome. And so especially when it's been up to the ALJ level. So I would say, you know, if the person's maybe since then tried work some more times and is kind of developing that evidence of why they're unable to work, had additional psychiatric or physical health exams, all of that would be important to include. So I wouldn't reapply without something else that wasn't considered in those initial and appeal level decisions.
Great, thank you, Jen. We have another person whose question is more around the VA benefit side, so if this is something that you can't answer, I will follow up and do some research to answer this question separately. And it's a question around non-service connected VA benefits, and if you can work at all while receiving those benefits. I know you're a Social Security benefits person, but I thought I'd ask, and if not, we'll follow up on that answer.
Sure. Yeah, I'm probably not the best to say if you can work while you're receiving pensions, the non-service connected, which is the VA pension. We don't get a lot of those, and I wouldn't be comfortable speaking for the VA.
Yeah, I will follow up for the folks who asked that question. I'll follow up and see if I can get an answer for you. Jen, another question. What have you seen in your experience are sort of the biggest challenges to folks starting to implement the SOAR model?
That's a great question. The biggest barriers are time and staffing to implement the SOAR model, because think of it as you are front-loading a lot of time. So as long as I said the training takes, it's because it's replicating a case. And so especially your first few SOAR cases, they do take a long time to gather the evidence, to fill out those forms, to advocate for your client. And I think one of the biggest barriers we find in the field is just everybody's having, so many jobs and so little time to do all of those tasks. And so helping with this and with Social Security is kind of too much. But I do think, I'm trying to think of other barriers, because that is just our biggest one. Because if you've got, the ability to move around some staff time where you can have one person even just focus on this for a day or a half a day every week, they'll be able to dedicate the resources so that it will get a lot faster over time, and it can be really beneficial to the organization. But we see that's the main reason we have barriers to implementing the SOAR model, because Social Security is really on board with what we're doing. They're huge supporters of this model. They have a lot of programs to support increasing access for individuals experiencing homelessness, but the time it takes to do it, I think, can get in the way.
Thank you, Jen. I did get a preliminary answer on the VA pension question, which is that it is based on other income, so that you would see sort of a dollar for dollar reduction. If you were earning $1 in income, it would be a $1 reduction in your pension benefits. That's preliminary, so I will do some further investigation, but that's our preliminary investigation, which is different than what you had explained, Jen, for Social Security benefits. Just checking to see if we had other questions. We had a question about who can take the SOAR training to start processing applications for Social Security benefits for veterans.
Yeah, that's a great question. Absolutely anybody. It's one of my favorite things about SOAR is you don't have to have special letters behind your name. You don't have to have kind of any special qualifications. You just have to have a passion for helping people and a kind of a basic level of writing, I would say, because we do, try to teach you how to write, like I said, a functional narrative about the applicant, and so that's really the basics that we need. There's no other qualifications, just jump right in, and like I said, it's free to take, it's self-paced, all online. There's no, once you start it, there's a ticking clock. It's really just working your way through. And so even if you're just kind of peripherally interested, I encourage you to go on the website. You have to register, but that's just so we keep track of kind of who's had interest, and that's how we have to run our software. But there's no obligation to complete the course at all if you've just registered to look around.
Great, thanks so much, Jen. I'm scrolling through to see if there's any other questions. I see a question about sort of strategies to help folks learn the SOAR model so that they can be better at implementing it.
Just so I make sure I get the question, so strategies to help people learn SOAR so they can get better at it, at doing the SOAR model?
Yeah.
Yeah, I think that's where our network of local leads, state leads, and national leads are really there to support you. And so it varies on where you're based in the country. Some places have a lot of SOAR workers, some places don't have as many, but even in those places that you may be the lone person in town, that's where the SOAR TA Center is here to help. We will answer your 1,001 questions. It's something we love to do. We've all been there in the field as SOAR workers, and so we know that there are 1,000 questions when you start, and that's perfectly okay. And so we're there to help support you through that. Those functional narratives that I'd mentioned, we call them medical summary reports as well. you can send those to us at the National Center, redacted, taking the person's name, social security, date of birth out of it, so it's all HIPAA compliant, and send those when you start working with applicants, so we can review it and, you know, give you some great feedback of, oh, it would be great if you knew more about this, or hey, could you ask your applicant about this, because that would be great evidence to include. And so we, I hope that we're, you know, your greatest allies in helping you learn the SOAR model, answer all those questions quickly, and get confident in this. Because you know, personally, I know I was terrified when I first started SOAR and helping applicants, and so I definitely want to be there and be that mentor for others.
Great, thank you so much, Jen. The last question that I have on my list here is, if you had to give someone sort of a key tip, key pointer of what to make sure they include in that application on behalf of a veteran, what would you want to make sure that's in there?
That's a great question. The most important thing that we do with SOAR, and I think that's what makes us different, is we make those clear connections between the symptoms and somebody's inability to function and to work. Because that is a huge reason why you'll meet people who've been denied so many times, because that's not really often in medical records or in other things that Social Security would see. But that's what we can bring to this application. Even if you don't go through the SOAR model and you're just helping someone, please, include as much detail as you can about how an individual's symptoms and conditions impair their ability to take care of themselves, complete their ADLs, impair their ability to have social functioning. So maybe they isolate themselves, or maybe they get into fights with other people, and how it impairs their ability to concentrate and memory and complete tasks, and then any recurrent hospitalizations or job losses as a result of this. Those are the four, we call them the 4 areas of functioning, and there's information too on our website, on Social Security's website about this, but that is probably the #1 thing that is always missing on applications, and it's why it's only maybe a 10 to 15% approval rate for individuals experiencing homelessness who don't have assistance. I mean, that's a big reason why it's so low. So that's great. And then I guess the second thing, I'm going to throw in a second key, is being that applicant's contact point. We teach individuals how to be the official appointed representative for disability, but you can also, if that's not what you want to do, be listed as a contact who knows the applicant and can get in touch with them, because that's a huge reason why people experiencing homelessness are denied, is because Social Security is just not able to get in touch with them.
Great. Well, thank you so much, Jen, for sharing your expertise and letting us all learn more about SOAR and this great model for helping veterans, homeless veterans, and anybody who's eligible for Social Security benefits to really access them. I had one question about being able to access the slides. Yes, there will be information about where to access the slides, and also the recording of the webinar if you'd like to hear it again at some other time in the future. So with that, again, thank you so much, Jen. We really appreciate it, and I hope you all have a great day. Thank you.
Thank you. My pleasure.